What did you think about it?
I really liked it because well, for me, it's not as like, I like how it meets you as like a patient would read it and they could understand it. Like that's what I really liked about it.
I wrote at the 6th grade level on purpose.
Yeah, no, and I think that was like the key why this is a really good one.
All right, guys, let's do this thing. 5, 2. All right, and welcome back to The Price for Paradise. My name's Woody, aka Creston Woods, and with me today, we're bringing back our first guest of the podcast. His full circle moment.
I love it.
Dr. Theresa Ramsey is back to talk about her book, Hormones 101, and I'm so excited to have you back. So thanks for coming back.
Thank you so much. I love your support. I love what you do too. So this is a great symbiotic relationship.
We've been doing this podcast for maybe 6 years now. And so this is going to be great to catch up and like see what you've been doing over at Revitalize.
Right.
So she's a functional medicine doctor. She works at Revitalize Functional Medicine and they have NAD therapies, hyperbaric. It's a great facility. So yeah, tell us what you've been doing lately and what's been going on.
Yeah, so my book came out in October.
Yeah.
And the book is really to educate people about the myth that hormones are risky, because that's been the belief for 30 years since I've been in practice.
Yeah.
Hormones are risky. Hormones are risky. I've had the privilege of studying with my teacher for 27 years, and all we do is what the research says to do. So I have a backup, which is the research in everything I do.
Yeah.
And, for years I've been fighting everyone else's doctor who tell them not to take what I give them because it's so risky, but it's just plain not. There's zero risks in what I do. And we get the privilege of helping people with fatigue and low libido and weight loss or whatever their goals are with hormones. And it's been such a pleasure, such an honor for me to be able to do this. And now I have the FDA backing me up. So what I mean by that is on November 10th of 2025, the FDA dropped the black box warning on estrogen causing breast cancer, estrogen replacement.
Oh, really?
So now I want them to say, let's use estrogen to reduce breast cancer in women. Like that's the next thing I hope in my lifetime. But, that's the biggest fear with most women is, am I going to get breast cancer from it? Well, the studies show women who take estrogen, specifically estradiol, compared to women who don't, have a much lower risk of breast cancer.
I think that when you're balanced, like you have better health outcomes in general, right? And so that's like,
exactly
it's just knowing where the balance is and at. And I have previously brought on a cancer oncologist, Dr. Chad Charrington. We talk about the same thing on the reciprocal end with men and testosterone.
Yes.
And how that's kind of debated on whether we should suppress the testosterone or give them testosterone when they're on testicular cancer because of the whole, like, it could give you better health outcomes to be balanced in your testosterone numbers too.
Testicular, I don't know, but prostate.
Prostate, yeah, okay.
Giving testosterone to men with low testosterone reduces prostate cancer risk 100%.
Okay, so that's what maybe I'm missetting that. So I'm not
No,
the
no,
expert
it's
on
fine.
hormones. That's why I brought her.
That's fine. But like in 1942, this guy, Charles B. Huggins, got a Nobel Prize for proving giving testosterone increases prostate cancer. He had one man in his study. How he got the Nobel Prize, long story short, that myth was dispelled by another urologist who biopsied every patient for a year. And the outcome of that was more men have prostate cancer than we know, and they don't get worse with testosterone.
They don't.
I mean, that's a beautiful thing.
Yeah, it's amazing, right?
And that's what we see in practice.
And we see so many good health outcomes when men are quality testosterone numbers, right?
Right,
I mean,
absolutely.
like they get more fit. Confidence is up.
Yes.
They're, making better decisions, all the above, right?
They sleep better. They're stronger. They're burning fat better.
They feel like a man. Honestly, like it's real though.
Yeah,
like, and when you know
real.
when your testosterone is not in the right place. And sometimes in our society, guys, think they're depressed or think that they're have mental health issues,
Very
but
true.
realistically, they could just be low testosterone or their hormones could be off. And so
100%.
yeah. So do you see because I see a lot of people go to SSRIs or like antidepressants and stuff like that where it's probably a hormone problem.
A lot of the times it is. In fact, there was a study done, and it was on women who had depression on sertraline, a specific antidepressant. And what they did in the studies, they gave half of the women some thyroid with it. The other half didn't. The women that had thyroid had no depression anymore. So I think of a lot of hormones for depression, thyroid replacement, and 99% of our patients have normal thyroid. We want to optimize hormones, we don't want to
Yeah.
be normal. Also, testosterone, especially in men, can cause depression. Low estrogen in women can cause depression. So all the hormones play a role, and what we like to do is balance them. Not just give one or two, but give them what the whole body needs. My teacher calls it full core press.
Yeah, you can't, because like, especially when you add one, it doesn't sometimes can aromatize to another one, or like if there's not a good balance, some things can change, right?
Yeah.
The body regulates itself too on top of that.
It does, and the balance is key, really key.
Yeah. And so what made you decide to write the book, and like why did you write it in this way? So there's like a specific way you wrote this. And so I really want to get into that.
You might find this funny. I find it sad. But I started writing this book about 20 years ago. And when I first started writing it, every sentence had a footnote, like a reference.
A reference.
And so therefore it didn't flow, and it was like written for doctors, it seemed. And I'm like, I don't like this anymore.
No
like,
patient's going to read this.
Yeah. And it wasn't my goal. So I restarted it 2 years ago, but with the intention to write it at a 6th grade level, because there's so much chaos about hormones. There's so much misconception. So I wanted to be very, very easy to read, so anybody could read it and understand it. And that's the feedback I'm getting, is it's so easy. I read it and gave it to a friend, and thank you so much. I get it now.
I give it to my clients all the time. And so like, I mean, I work with a lot of special cases, and like, I mean, my mom loves it too, because I send my mom to Theresa as well. And so I do think that like,
thank you for trusting her with our care.
Of course. Yeah, no, only the best. And so, but I do think that this book is like, it's just perfect for giving to a client and meeting them where they're at, because a lot of them like they get lost when you give them all like the scientific jargon and details and everything.
Right. And so November 10th, the FDA said estrogen safe in breast cancer patients. Now in December December 10th, 2025, the FDA is dropping for testosterone the limitations, right? So they used to say if your testosterone is not below 300, you don't get testosterone. They're lifting that off. So more men have access to testosterone now.
Nice.
So, it's just so wonderful, because I didn't believe in my lifetime I was going to see all this happen.
And so when do you think that men should start testosterone? And like what age is that like seem like a route that we need to go into?
You might find this surprising. We have some men in their 20s who have low testosterone. Typically the cause is going to be that belly fat. Yeah. And so I will put these young men on testosterone for 1 year, burn it off, and then they make it themselves. But typically I'd say I'd like men to start checking their levels around 40.
Around 40?
Yeah.
Okay. So it's not something that you need to do when you're our age, guys. Well, I mean, I'm 30, right? We're almost 10 years away. But do you think it's better to, so start looking then at 40?
That's what I say. But
But if you see symptoms, like there's a lot of guys in the society with low T.
Right. Men come in with erectile dysfunction, low libido. We measure their labs, and inevitably they're low.
Yeah, and then talk to me a little bit about erectile dysfunction. Is it always a testosterone problem, or are there other issues as well?
Well, the main testosterone is one issue, but the main issue could be heart disease, because heart disease is our circulation.
Oh, yeah.
So if our circulation is compromised, erections will be compromised. And then that man gets a stent, now he gets erections. It's amazing.
Yeah, and then you add like nitric oxide boosters or something side of things instead of doing the testosterone if it's not needed.
Right. Or we do both to get men off of blood pressure medicine. The nitric oxide gets men off of blood pressure medication too.
And I think the psychological side of being on testosterone would help the libido side of things as well. Like the confidence that comes naturally with that, right?
Right, okay. Absolutely. Yeah, so we know it's safe, and testosterone in women significantly reduces breast cancer.
Really?
So, I mean, it does other things, but like the fact that so many things protect the breast, not taking any hormones in the aging process leaves us vulnerable to breast cancer.
What do you think about people taking hormones post remission and after they've gotten things removed?
Well, it's interesting because the one woman, the woman I gave the hormones the soonest to was the day after her lumpectomy.
Oh, wow.
Because her husband's a doctor, and he's like, you need something, because you change a lot. Like when you're on hormones and you go off of them, you miss them in your brain, in your emotions, in your energy, everything.
You feel like a different person.
Right. So it wasn't contraindicated as far as I'm concerned. The literature, like I should say the guidelines would say wait 5 years. I'd never wait 5 years, and I haven't had a recurrence, knock on wood. And so they do great with it. It's not a contraindication, and the FDA agrees with me. Thank you.
And so do you think it's just a big problem with like what we see in social media, society, what we get marketed. Like, I mean, not everybody's getting the information. They, you know, there's an overload of random information on the internet.
There is. And now because of these, drops of black box warning things, now I'm seeing a lot of people pop up I've never seen before talking about doing hormones, et cetera. And I'm like, are we doing it right? Because to me, the most important thing is if we're going to treat a patient with hormones, that we do it right.
Yeah.
Because we can create risks that are unnecessary.
Just as much good as we can do bad with the hormones when it comes to hormones, right?
So we're starting an online course for physicians. Whoever wants to learn how to do it, it's going to be very basic for them too, so they feel confident giving their patients hormones.
I love it.
I'm just so excited about this time.
Is there any situations where you wouldn't recommend someone figuring out hormones?
I've never met a patient I didn't think hormones could help.
Hey,
No.
that's that's your specialty, so I wouldn't be surprised. And so, tell me a little bit about what you see most then. What is the go-to for people that you see in your clinic on a daily basis?
So the common things, and we see this over and over and over, would be fatigue, insomnia, weight gain, depression, anxiety. I mean, and then we also see things that can be treated with hormones like constipation, dry skin, hair thinning. Like all of these things I can throw a hormone at. Yeah. So, and now that it's more acceptable, we're already seeing more patients dropping their guard and their fear, and wanting them. So we see that. And then there's different delivery methods, et cetera. The one thing that we do different than most hormone clinics for women is when I give estradiol, I give it in an oral form. Most doctors are afraid of it. They all want to do topical estradiol, which works for certain things. But when you do topical, which could be a patch, a cream, or a pellet, you're missing out on preventing their brain from Alzheimer's. Oral estradiol reduces Alzheimer's 85%. Topical does not.
So it doesn't break the blood-brain barrier through the derm.
And the other thing it does with Alzheimer's and heart disease, because it also reduces that, is it turns on an enzyme that sweeps our vessels clear. It's the most beautiful thing. No one needs a statin if they're on estradiol. No one needs a statin anyway.
Yeah, right. Yeah, no, I agree with that.
But estradiol is our statin, among other things.
Oh, fascinating.
Yeah.
And then I do have a lot of girls with breast cancer. And then the other thing I get is a lot is PCOS. So the two different things. But can you talk a little bit about PCOS?
Right.
That one's
So the thing I have been learning for the last 27 years about PCOS women is everyone has it until proven otherwise, because it's really important to prevent them from breast cancer, uterine cancer, diabetes, Alzheimer's, heart disease. Those are the risks of PCOS that we can prevent as early as the woman comes to us. Like the longer we prevent them, the less likely they're going to express any of those diseases. So, and PCOS women, 50% are heavy, 50% are thin. Like you can't just point at a woman and say she has PCOS anymore, because a lot of thin women have it.
So many women have it. Yeah, no, I mean, I talk to girls in the gym all the time, and that's one of the first few things that they tell me in their intro meetings when they come to become a client is that they have this, and that is, it's an interesting week of the month when we have cysts and different things in play as well.
Right. And so to diagnose a woman, we have to get her blood the week before her menses to be able to diagnose it. If it's drawn any other time, we're going to miss a diagnosis.
Oh, okay. Interesting.
Yeah. So I love PCOS women because they do so well.
And they respond really well from the treatment. Yeah,
they really do. And it's just so satisfying, to be able to help so many people.
And then talk to me a little about the breast cancer. We're going back on that. A lot of those girls are scared to go on any hormones.
I know.
Every single one of them I talk to is scared to go back on hormones afterwards. And after talking to you, you're so confident about it. It's it makes me oh, you should just go see Dr. Ramsey right now. But
even women don't start hormones because they're afraid of it, period. They don't have
because
breast
it's a general fear.
Right. And so this is interesting. So my book came out a month before the FDA's changes. In 2002, when that big article came out, which I'll tell you a little bit about, I happened to be teaching that night that it came out. And so I was teaching at a local library, and we had maybe 12 people signed up. I walk in, every seat is taken. I'm like, what is going on here? Well, the article came out. I hadn't known it yet. There was a rep in the audience for the drug Prempro, so this study that came out in 2002 said hormones are risky, put women on antidepressants instead, so they don't know how bad they feel. Well, it was a very interesting study because there was 3 arms. Do you want me to go through this?
Yeah, please.
So the one arm was Premarin, the first estrogen for menopausal women. Premarin comes from pregnant mares' urine, horses. And unfortunately, they keep them still. They dehydrate them to get this drug. It's unfortunate.
Yeah.
But Premarin worked well. So in the study was Premarin, And then women who had a uterus had to take progesterone to not get uterine cancer. So they were on Prem Pro. That's synthetic estrogen, synthetic progesterone. Progestin is what I have to say. It's not a progesterone. And so then they had a placebo. So in 5.4 years, the Prem Pro arm had stopped. They halted that. They told everybody, get off your hormones. But what most people don't know is the Premarin arm and the placebo arm kept going because the results were so good. So compared to placebo, women on Premarin had lower risk of breast cancer.
Nice.
Lower risk of heart disease. Of course, they had stronger bones because osteoporosis is caused by lack of estrogen. And so the whole study wasn't terrible, just that one arm was. The problem with Premarin compared to estradiol, which is bioidentical, is it does increase blood clot, strokes, and heart attacks, where bioidentical estradiol never does.
Yeah, and explain to the people what bioidentical is compared. Yeah,
it's exactly what we made. It's made in compounding pharmacies. There are some commercially available, but they fit into our receptors properly, so our DNA gets the right message. Synthetic ones don't always give the right message, especially Prem Pro. The progestin is wicked with blood clots, etc. We don't use them, but the studies have been done showing, risky, no risk.
Okay, perfect. Yeah, no, that's just a good clarification for the people when it comes to hormones and taking stuff. And so what you also do with hormones is you also recommend like the supplements that support all the hormones, right? And like the lifestyle around that. And so talk to me about like what you do with the client once you get them on a plan and like explain to them like what they have to do next.
The first visit, we just do hormones. Whether they came for weight loss or insomnia, we're just doing hormones. Oftentimes when we see them in 6 weeks, they're sleeping better. Oftentimes they've lost a little bit of weight, so the conversation becomes easier. But there's certain things that I feel like we all need to support our hormones, like gut health, probiotics, and the reason B complex is so important to me is because so many people have the MTHFR, the methylated problem,
group,
methylated folic acid problem. So that's important for most of my patients as well. Vitamin D is actually a hormone. And so all of our patients are on D because the research on hormone D3 is that in cancer patients, the ones that have the highest level of D have the best outcomes.
For sure.
Lowest, poorest outcomes. I think of vitamin D as my antibiotic. So if I am exposed to people sick in my office, I pop a high D, 50,000 units, and it works as an antibiotic.
And I think people are scared of high dose vitamin D, but it's really good. Like you can't really go wrong with it either, right?
Because their doctors say it's too high. That's why. But there's one side effect. I saw it once in a patient who was taking my 50,000 D3 twice a day for 3 months. That's 100,000 units every day.
That's so much.
I know.
It's an insane amount. Like,
I was like, what? So anyway, she had muscle cramps throughout her body. That's the side. If you get that, lower your vitamin D. Not just a cramp in your calf. You know, it's like all over twitching. You go off of it, but within 2 days, they're gone.
Yeah, and I mean, I saw somebody get like 600,000 IUs at once on accident and survive. So like, I don't think that it's like as scary as people give it credit for. 10,000 IUs a day, really good, right?
Yeah, 10,000 is a good maintenance. But even if I'm exposed, I might take that 53 times that day.
Just a super dose it.
Yeah, and then that's it. And I don't get any side effects whatsoever.
Oh, amazing. Yeah. And so vitamin D, any other hormones you would stay away from? Like anything that you would stay away from to affect hormones, like melatonin or anything like that? You love melatonin? Okay.
We never block estrogen. Like that's a big deal in medicine.
Yeah, estrogen blockers. That's a lot in the fitness world because a lot of people are trying to, maximize gains, raise testosterone as a byproduct.
Right, right. So testosterone converts into estrogen in all bodies, like in my body, in your body. Yeah. You aromatize into estrogen. And so the theory is you block the estrogen so you make more testosterone. But men need estrogen the same reasons that we need estrogen. And that's why I don't block it. And many men come in on them and I just toss them in the garbage. But they think they're taking it to prevent man boobs.
Yeah, they don't want to get gynecomastia or anything.
And you don't get man boobs if your testosterone dose is high enough because man boobs are subcutaneous fat. Testosterone burns subcutaneous fat.
Yeah, if you're high test, you should have pecs, not man boobs. Okay.
So we never get that complaint about man boobs, and so we don't have to block estrogen.
And then question, how high would you go on a male's testosterone? Would you let them like would you let them go like to a large amount, or would what's the microdosing? Is that like the standard practice? Like what do you do there?
Interesting question.
Because I have all the gym guys would be like, give me whatever I can get, and then the other people are like, microdose me so I don't lose my endogenous support.
That is so funny. Funny because like my clinic is known as being edgy with hormones. Like I want to get results.
Yeah.
I don't want to just give a little bit of this and a little bit of that. I want to get results.
Of course.
And so it's whatever it takes. So, we'll talk about injectable testosterone. Our typical starting dose of that is 200 milligrams twice a week IM. So it's a full CC. I have men that come into me on half a cc a week or every other week, and they feel nothing. They're thinking testosterone doesn't work. I'm like, it's dose related. So as soon as you get their dose up, now some men might go higher, not a problem if they don't have side effects, which I'll tell you. And some men go lower because it feels too much for them. But we let our patients decide. Okay. No number is too high.
Okay.
To me, it is to a lot of doctors, but it's not too high for me.
All right. And what's the biggest improvement you've seen someone jump from? Like, cause like, I think that there are like outrageous testosterone numbers out there. And I've heard people be 1,100 points or something crazy.
And if it was risky, I would care about it, but the number isn't risky. And I know some people listening to this who have lower numbers are going to think what I do is risky. It's not. I've seen a man go from 300 to 3,000.
Yeah.
So again, I don't look at the total. I look at the free testosterone. But even if they're high on that, as long as they don't have side effects. So in men, 10% will get hair thinning and acne. It's a minor compared to women. 90% of women get that. So we have to manage the side effects.
90% of women get that?
Yeah.
Oh, that's the scary part about it. If you go like high enough.
Yep. And I will say I prescribe what I do for, in 90% of my women is I give them spironolactone. It's a drug. I take it too because it works so well for preventing hair thinning and acne in women. So in men, I use supplements like NAC and zinc. That works. Cleaning up their liver. We have to clean up our liver.
NAC is one of my favorites. Yeah, no, I'm with you on that. But interesting. So the dose matters for testosterone. And question, is it like, yeah, like what are the other negative side effects for men? Like, could they aromatize more? Like the more you go high dose? I mean, everybody's different, right? So like, it's like what you're doing out, other variables would attract it.
And even if they do, and their estrogen's 300, that's fine too. Like,
that's okay.
That's perfectly fine. Their bones are strong. Everything is strong, for them. They will feel it going off. That's for sure. Even with, I get a lot of rap from other doctors regarding thyroid numbers because our thyroid numbers are extreme. Like we suppress the TSH, make sure the T3, which is the pivotal thyroid hormone, not T4, which is synthroid and levothyroxine. It's the liothyronine. Or we use NP thyroid, which is a blend of two, etc. So thyroid we give, and it just makes aging so much easier. It gets rid of inflammation. I can't
metabolism
tell you how much.
Help.
Increases
like, oh my
metabolism.
gosh. Yeah.
And here's an example of increased metabolism. If someone is very dry and they have to moisturize, my goal is to give them enough thyroid so they don't have to.
They
and
start to produce cell turnover.
Constipation, thyroid.
Really? Okay. Cool.
Brain fog, thyroid. So our numbers are crazy, and I know that. Our patients love it. And now if I have a patient who wants me to be more conservative, of course I will. And I do have some of them, and I go more gently. It's really about what the patient wants.
Okay, cool. Yeah, no, I like the freedom of choice to do whatever you want with the data given and like the recommendation from a good doctor. So, and that's cool. And I do think that sometimes people are a little conservative and they don't get results. And then people think that these therapies don't work. And that is like, that's not true. They work.
Yep.
We have science to prove it. We have case studies. We got all of this stuff. We know the answers to your problems. It's just adherence to the plan and a lot of things like that, right?
And that drives my teacher crazy because we look over all the articles ever written, right? And so there's this article on testosterone had no increase in libido or erectile function. Well, they took 2 milligrams, right? The dosage in the study is like, of course they're not going to show anything.
Yeah.
So like, thankful for him, I understand it. Like I'm not a researcher, but I use what the research has taught me to treat people.
Yeah, and then you've been doing this for how long now? So
I've been in practice 30. I've been doing the hormones 27 years.
27 years. So I mean, the amount of people you've seen,
I know,
and like the amount of case studies you have, just personal, like it says all that you need to know, right? And so as much as you can new studies are coming out, you kind of know
they've been done.
They've all been done. Like there's not much more we can do with it, right? Yeah.
Right. In fact, I'll tell you if I can talk about women for a little bit.
Yeah, please.
So the biggest risk I see coming into my clinic is that when women are on estradiol from another provider, not one of them to this date is on enough progesterone to prevent uterine cancer. That's the risk. is if we give estrogen without enough progesterone, they will develop uterine cancer. We learned this when Premarin came on the market in 1946. In 1956, all the women with uterus had uterine cancer.
Oh my gosh.
There was no progesterone. That's how we learn. That's why we study and do studies. So I'm also very heavy-handed with progesterone, and there's some GYNs that think I'm nuts because they believe it's the Prem Pro. They think it's a synthetic.
They think it's
form.
the old one.
Yeah,
Okay, so they just
GYN. People go to you guys. You have to have this knowledge. And I know, and it's taken me, it's a rigorous training, to do this. It's intense weekends. I go every year with my teacher. It's not for the faint of heart. I'll tell you that.
Yeah.
But I'm going to make it easy enough for doctors to just say, okay, I can do this and, feel good about it.
and feel confident in prescribing and doing the things with these patients because, there's no time like we gotta go. We gotta make progress. We can't just wait around. If you wait around forever, you're gonna lose 20 years of your life, and you're not gonna have the fun that you need to have and live the life you want to be.
And that's where I feel so blessed being introduced to this so young. Like the week after I had my youngest son, I went into menopause. My mom went in at the same age, 40 years old. So I knew what to do, and I was right on hormones. I didn't miss a beat. Like I wasn't down at all. And I've now been on them 21 years. And
you look great.
Can't feel better, except for when I was in the hospital.
Yeah.
But in general, I can't feel better.
Yeah. And tell us a little bit about what happened in the hospital.
Oh, this was crazy.
This
out
is
of the blue. Anyway, I was preparing to travel for a month to go into Colombia to integrate with the culture. And 2 days before that, I got an infection. I was high fever. And I thought, okay, no problem. I get over them very quickly.
Yeah.
But on day 3, the day before I was supposed to travel, I stand up and there's pure blood coming out of my rectum.
Oh my gosh.
Blood. I'm like, what the heck is this?
Yeah.
I'm in the hospital. They discover that I have a small intestine infection. The whole intestine lit up on the CT scan. There was an infection embedded in it, but they couldn't find it. They just kept giving me antibiotics and antacids and everything. I'm sitting here at the mercy. And the hospital was great. They treated me well. They wanted the best for me, but they just couldn't find it.
Yeah.
So on day 11, I'm like, I really have to go. And they're like, you can't. Your white count keeps going up. I'm like,
I'm a doctor. I can handle it.
I need my feet in the grass. I need my food, my bed. I need to feel comfort. And
there's a lot of healing that goes along with that
Right.
when you're in your space and you're in that
Exactly.
not in a hospital room with bright neon lights and
I know.
It's the
Thank
worst
God.
place to heal.
I have to say thank God to my daughter-in-law. She got me this beautiful mattress because I felt like I was laying on springs and rods. And she gave me this mattress that made me feel like I could be there for 11 days, and that was it. And so I'm so grateful for the medicine I provide, which is functional medicine other than hormones. We do IV therapy, and I want to share so that you understand what I mean by this, that whenever we die, any person dies, the reason they die is their NAD levels go to 0. Doesn't matter what their diagnosis was.
Yeah.
And I love NAD. We could do that on another show maybe. But and I can do NAD in an hour, typically. Now it's my first day going into my office after I got out of the hospital. It took me 9 hours to get through a half bag because it was so painful. I had so much ascites, blood in my belly, and it really hurt. I could hardly go. I was trying to turn it off. My staff pushed me, thank God. And then enough IVs later, I just turned the corner because NAD brought me back to life. My microbiome was dead because of all the antibiotics.
Yeah, because you went to the hospital first and they just started pumping you full of antibiotics, trying to kill the thing.
Right. So I make my homemade yogurt, which I eat twice a day, every day. I take probiotics on top of that. So I feel like everything's, back. I had to gain my muscle mass back that I lost. It's amazing how quickly you do.
Yeah, you atrophy quick. Yeah,
Right.
if you don't use it, you lose it.
Right. So then in my lab that I did, I found the infection. But by the time I got the results back, I had cured it by doing rectal ozone, kills GI infections.
Oh, wow.
So, without this medicine, Woody, I don't think I'd be here like this
what
today.
a testament to yourself. You're over here
I'm so grateful.
It's not working in the hospital, so I'm going to go home and try my own thing. And then all of a sudden it works itself out. That's amazing.
Yeah. And it all worked out through my hair. I lost all my hair.
Yeah.
And it wasn't even that emotional because I knew it would grow back.
Yeah, it's coming back right now.
And you know what? If I don't have hair, I have a health. And I have this great relationship with God now, and I'm happy.
I love it. I love it. And you talk about God. You've been going back into the faith and doing stuff like that?
100%. Yeah, I started that journey about a year ago because I was always spiritual, but then something shifted me to be more God-loving, Jesus-loving.
Yeah.
And it has really blessed my life. I mean, because I can feel when I'm making the right decision more now.
Yeah.
In fact, before the hospital, I didn't have insurance, and I kept hearing, "Get insurance." I'm like, "No, get insurance, no." Even
don't
the
believe it.
shrimp I ate, there was this question about eating it. That's what made me sick.
Yeah.
I'm like, "Oh, I'm just going to eat it." So I'm going to not exert my will. I'm going to let God exert His will through
Yeah.
me. Yeah.
I love it. No, and it's really like funny you say this is like the last few episodes. I mean, James can attest behind the camera because everyone has been coming on the podcast and talking about their story and their thing, but then it all leads back to that everyone's been going through a revival or like
Yes.
you know, and
Yes.
it seems like everyone's like really getting back on the horse when it comes to their faith and their beliefs. And
I
so,
know.
and it really drives like how our outcomes are in life and what we're
100%.
doing. So I do believe that that's like part of the price for paradise. Like,
yes.
and so, yeah.
yeah, I love that.
And so that's really cool that you're getting back into it. I
I
love
didn't
to
know
hear
you were
it.
faith filled. That makes me happy.
I am. I've been going to church recently. I'm
Mm-hmm.
on like a 8-week streak of going to Grace Community Church. And
Nice.
so yeah, I found one recently. I've been testing all of them out, but
I did
you
the
have
same thing.
you do have to find the right one because you will get turned off right away the first time you
Right.
just walk into one random one and see what happens.
I know. I probably went to 6 or 7 before I chose mine.
Oh, yeah.
And I understand that journey.
Oh, and so speaking of this, I'm glad you're here. And so I was in the first time I went to a church. I went to, I'm not even going to say the church. I'm not going to discount them.
Right,
I'm just,
right.
because some people might actually still find like really good help from this person. But the pastor came up there and he's talking about health. And then he goes, "Oh, I'm going to talk to you guys about physical health." And then I was like, "Oh no, where's this going to go?" And he's like, "If you're not feeling the presence of God, you need to go get like out of your, like on an antidepressant and like get fixed. And then you can, you know."
I think
and I was
antidepressant
like,
separates us.
yeah,
from
that's
God.
like, no, like,
Yeah.
like maybe fast and to go talk to God or something. Like do the other thing. And so
Interesting.
I was turned away from that church. And so it is
Well,
one that you really want to. And I'm not saying
exactly.
like there's all no cases for those, but like saying that to a whole congregation is
I know.
a little bold.
We have to individually feel nourished when we go.
Yeah,
You know,
right.
if we don't, then we don't go. So I don't know if you know this, Woody, but did you know that I did a Bupo or DMT, kind of like ayahuasca,
Oh, yeah.
to heal my grief from losing my partner?
I didn't know you did that,
So I
but
did
amazing.
this
Yeah.
last March, and it was the best thing I could have done. It's called the God Molecule, and I was with God before my incarnation. Everything made sense. It was the most beautiful thing I did. So that third, because you do 3 weeks in a row, it's 2 hours. You can drive afterwards. Is I went to the church I was going to, thinking I liked it. And when I heard the pastor start screaming, I left. I was like, okay, this is not resonating with my nervous system.
Yeah.
So then I kept looking, and then I found mine. Mine's called Pillar.
Pillar. Okay.
Yeah.
Okay. Amazing. Yeah. And our last guest was it was about an ayahuasca journey.
It
so
was?
yes, and so he explained the whole scenario of what he went through and like how they mix the medicines and do all of the things. But how did you
Yeah.
feel about that? Like you like felt like reborn afterwards? Was it like a eye-opening experience?
Well, I did it for 2 reasons. I had 2 goals. One was to get closer to God. The other was to heal my grief because I was carrying for 10 years this density after my partner passed. And after the third one, I'm driving to yoga, and I went, ooh, my body's lighter. Like it would just boom, it just left me.
Like a piece.
The grief.
Yeah.
Yeah, I don't have it anymore. And of course, my relationship to God, I kept nourishing. So the people I did it with here in Arizona do it for trauma. I don't know if he did it for trauma.
So yeah, my last guy, he was in the Navy, like went through Navy SEAL training, and like
Yes.
his friend went suicide, and he went to this ayahuasca journey trying to heal some traumas.
Okay.
He didn't get exactly that. Like, you know, he went through more like childhood stuff than he did like what he thought he was going to go
Right.
through like during the
Right.
ceremony. But
Maybe the next
you got
one.
what you needed,
Yeah,
right? Like,
exactly.
you know? And so
Always.
that's the thing is like the medicine brings out what you needed.
I agree. 100%.
And so, yeah. And so you're a fan of, you know, psychedelics and like plant medicines in that sense too?
Well, the female of this couple that does these ceremonies is a nurse, and she worked in mental health. And she said, I don't get anywhere with medications. And so she switched to doing the psychedelics. And she gets great results now.
Well, I think a lot of times cancer patients could see really, really good results of like mindset work, going
Yes.
through a journey and doing
Yes.
that. But it is, again, scary for people when you say
is.
psychedelic therapy or you do
Well, even
anything
for me,
outside of that. Yeah,
Yeah,
right.
the third one, I'm finding myself as I'm driving getting anxious, and I don't get anxious. So I'm feeling this. I'm like, what is that? I'm feeling anxious. And then I heard it's all about faith. I'm like, okay, I'm fine.
Like, just let go.
Yeah.
Just woof.
It's like, thank you. So
Yeah.
it is not easy. You have to be faithful and you have to be ready to surrender.
Yeah, you got to let go to the experience. If you fight it, it's like the ice bath. You'll hate it.
You will hate it.
You will hate it.
Yes.
But if you just let go and breathe and just let the medicine do its work, it will do its work for sure.
So beautiful.
And that's really cool that you do that too. But now, side note on hormones, can we talk a little bit about peptides?
Yes.
And your thoughts on peptides and where, like, it's the new fad. Everyone's doing peptides these days.
They work great.
And they work great, and there's a lot less risk. So, like, that is
I haven't seen
a nice
this.
thing. Yeah.
And the only risk we hear about in our training is injection site sensitivity.
Yeah,
But
you can
we
get
don't
an
hear that
infection doing that no matter what.
Right,
Yeah.
right. And that might be like there's some you could buy online. I don't know about those.
You just want to make sure you get a good,
We use compounding
product.
pharmacies.
Yeah.
And they're great on top of hormones. I've had patients ask me for peptides that are menopausal and not on hormones. I won't do it because they're not going to get as much out of it.
Oh, okay.
I mean, could I sell it and make some money? Yeah. But I really want to do the best thing for the patient.
Yeah, and that's the best kind of healer, right?
Yeah.
And I take oral BPC, especially when I get injured or like I want to heal the gut. I hear it's better for the gut, but
It's so good for the gut.
yeah, and so I do that. I haven't done any of the other peptides, but I hear a lot about them out there in the gym, and so
like for any injury, like if there's a tendonitis and you do BPC every 4 hours, you can get in front of it in a day. I mean, it's that powerful.
so fast, yeah.
It's
and,
that powerful.
And I think like combining it with like newbie therapy and some like PT work, like a lot of people go to 63 PT sessions without they're still walking with a cane, and now like you could add the peptide to it and the
and amino
do
acids.
all of the stuff and the amino acids and the building blocks for
Right.
all of the stuff, collagen, all the things we need for our injuries. But yeah,
Exactly. Yeah. So the popular peptides are like the growth hormone ones, like CJC, ipamorelin, tesamorelin, and what they do is they increase your HGH, which builds muscle, burns fat. There are some for memory that we use. There's some for orgasm. Like there's a lot of different ones. I use the one for hair, which is GHK.
yeah.
And it seemed to work really well.
And so, how often are you prescribing peptides compared to hormones? Or is it like always like a big list of you're doing some of each? And
Yeah, every day, of course, we do hormones with many patients, and every day we do peptides with some patients. They're becoming more and more in demand in our clinic.
yeah, I mean, and then especially with the rise of GLP-1s, like everyone's like loving the
Right.
GLP-1s these days, and
Right.
I do think that they are a big part of health nowadays, and I think that they're huge for people that are really overweight and obese. Is like sometimes you got to go harder,
Exactly.
and we got to get results, right?
Yeah.
And so
And,
that
you know,
is
I love the GLPs. There's a lot of negative chatter about it. We are very particular. If we have a patient on GLP-1, if they're losing muscle instead of fat, we take them off.
yeah, that's the biggest thing.
Yeah,
That's
so we
for
really
sure.
watch them. Of course, we don't want them to have any side effects. But yesterday, one of my beautiful patients who's only been on it for maybe a year says, there's no food noise. She's a lawyer. No food noise. Like she's not thinking about food and, comforting with that at all. And I'm like, that's so beautiful. In fact, we have a female thinner than me who has had pre-diabetes. She takes a microdose and doesn't have it anymore.
Amazing.
Yeah.
Yes.
She's not using it for weight loss, but her A1C dropped.
And so, is there any reason why we shouldn't be on them, the GLP-1s?
If we're not eating high protein, if we're not exercising, if we're not being mindful about what we're losing, that to me is a train wreck because we can cause skinny fat people. Right?
Yeah, and we have like an undereating problem for some people too. It's not always an overeating
Exactly.
problem. And so a lot of times, like I went on a diet last year where I tried the plant-based diet, and then I tried like a more animal-based forward diet.
Right.
And through both of them, I was eating more than I've ever eaten, but because I was eating, non-processed foods and
That's
it was
right.
all super clean, I was eating 4,000 calories and I lost 10 pounds. Like, and that's like, it's
You're
crazy.
doing it
But
right.
I also do a lot of activity level and do a lot of that, so I had
Sure.
to raise it that much. But when I was eating lower, I was having a harder time actually.
Of course.
Just slowing myself down, and I was still putting on weight, and I was like, why am I not losing this weight?
So you were eating frequently, like every 3 hours?
Yeah, and so when we did the diet, we had to all meal prepped every meal and every snack. So
Yes.
throughout the day, we're eating the whole time,
That's
and
awesome,
like,
yeah.
it was a pretty cool
I
experiment.
think that's the best way to turn your metabolism on is keep the good food coming in.
Keep the good food coming in,
I
and
really
then what are your thoughts on fasting?
You know, it's interesting you asked because I did a 3-day fast for the first time. I wake up starving every morning, right? So for me to do a fast, it's got to take a lot.
You're probably on the underside of eating than the overside of eating, and that's like why fasting for us, like who don't eat enough, sometimes it can be kind of draw from your energy. But sometimes you do need that cellular cleanup, and so it's good to every once in a while go through, fast from all things.
And what motivated me was Gary Brecka. He did an hour on his 3-day cleanse, and he goes through the science and everything. I'm like, you know what? My body deserves that. And so I did it. I did it with bone broth. And, I did struggle a little bit, but when I was done, I felt amazing.
Yeah. What do you think about Gary Brecka? Do you like Gary Brecka?
I think he's awesome.
I think he's really good. He brings a lot of attention to a lot of things. Mm-hmm. He is a little bit of a salesman sometimes, and so he's definitely like trying to he says things in ways that really get you excited about everything. Not every fix is for everyone, but I do think that he is really good at drawing attention to some things, therapies that we haven't been touching on a lot, and exposed to, yeah, for sure. Like the methylated B vitamins was like big with him, and
That's
then
true.
What do you think about hydrogen water?
I tried hydrogen water many times. I don't never feel different, so I don't stay on it. Like if I feel something works, I stay with it. Typically, that's how
agreed.
It is.
Yeah.
So what do you think of it?
So I tried it from one of those water bottles, and I didn't really see an effect from the water bottles. But when I take the tablets and I throw them into water, I do feel very clear-headed and I feel better. So I don't know if it's. I think the tablets just saturate really fast, but you got to drink it before it goes out into the.
I didn't know that.
Into the air. So yeah, you have to drink within 5 minutes after you put that in, or that hydrogen evaporates out of the water, and then you. But I do think that I noticed that when I did endurance, I did like an ultra marathon last month, and leading up to that week, I tried it, and I felt amazing every time I drank it. I was like clear-headed right after. So I don't know if it was placebo. Could have been, but
well, if you have me back, I'll try it before then.
Yeah, for sure, for sure. And so, tell me a little bit more about the book. So, what was your hardest chapter writing this book, and what was the thing that you had to do the most research on? I guess
like the research I've been doing for I don't do it. I learn it.
Yeah, and you can see the back here. There's 300 references.
Yeah, I know. Yeah. So people say there's no articles. Guess what? There are thousands. Some good, some bad. Studies. But there was really no chapter that was difficult. It pretty much just flowed, especially making it simple. Instead of all the details. And that's why I put all the references at the back, is because I didn't want to have to number them. But I think my favorite chapter was on heart disease because of how much we can reduce heart disease and how prevalent it is.
Yeah, there's so many people with heart disease out there, right?
Yeah. So, that was one of my favorites. Of course, PCOS was one of my favorites. But the very first chapter is called Truth versus Myth, because that's what I've been hearing all these years. Like, what you're doing is risky. What you're doing, no, I wouldn't be doing it if it was risky. And so that was really important to say. There's some pivotal studies that have told us this is risky, but the bioidentical is not. There's just a bunch of pivotal ones. And that's what made the first chapter.
Yeah, and a lot of influencers out there cherry pick whatever study they want to fit their ideas and whatnot. And so for you to let's clear out the space. Let's talk about what's truth. Let's talk about what's myth, because there's a lot of stuff out there.
Yeah.
So much stuff. But let's go to the doctors that specialize in hormones to learn our stuff,
And that's true, because men go to urologists. They don't put them on testosterone. Women go to GYNs. They think progesterone is progestin. It drives me nuts. So therefore, we'll have our course. And all doctors can prescribe.
Yeah, I want to get you on here with Chad and talk about cancer and hormones too, because I do think that even in the oncology space, a lot of these, even the oncologists are scared to do things that are risky, or via to lose their license. Not necessarily risky in the sense you're saying. It's these aren't risky things, but for him to do this is a risky for his job, right? And so,
exactly.
And how do we get that to make it more available for Ironwood Cancer Clinic to do stuff like this? Read the book. Read the book.
It's so easy. You'll get through it in a day. That was my whole goal. But yeah, that is, the misconceptions out there are what guide patients. Misconceptions in doctors. So I think it's changing. Definitely it's changing. I think especially with the FDA, especially with all the new things I'm seeing on Instagram of these experts that I've never heard of. And I don't know how they prescribe, but I have read a few of them, and women who treat, it seems to be women, gynecologists treating women, they're always using topical estrogen. I'm like, oh, they're missing out. I'm giving low dose progesterone. Oh, they might develop uterine cancer. It makes me a little nervous. I've been blessed being able to study this, and I can't wait to share it.
And it seems like you continuously study over the time. And it's like sometimes people will find one thing that works for them, and then they never kind of dive deeper and deeper into these things. But you found the most optimal way for things to happen nowadays.
Yeah. And how it started for me is when I was first in practice, 1996, I would have all these women coming to me with Suzanne Summers' books. I'm like, I don't know. I wasn't really trained in hormones. I was trained to do saliva tests and creams, which, ugh. So I went to her doctor in Santa Barbara and studied with her for a year just to learn. And then I kind of met my teacher through the emails that came through her, and he taught the research. She did not teach the research. I want to make sure what I'm doing is right, not just an opinion. And so when I met my teacher, that's when everything changed.
Yeah. You got to find the right mentor and everything. Yeah. So I'm glad I got this newbie. My mentor hooked me up with it. I would have never even known, but it's, and she's on it right now. You know, we got the stim running on through her back, but you talked to me a little bit about Alzheimer's and how hormones could help that one, because I was wondering, like, since it's like it's brain, nervous system, it's like all of that, like how can we get people to not atrophy as fast? And
well, if you think of Alzheimer's being type 3 diabetes, you get an idea, because it is type 3 diabetes. And the number one I do to prevent, but there's many layers, is the oral estradiol for men as well. I give men, I don't block it, I give it to men. Because I want to turn that enzyme on to get rid of the plaque in the brain, in our vessels. So it really works well. And if you start it sooner, you can prevent it. 85% prevention in the Cache County study was a beautiful thing.
Amazing.
And that also is I'm going to use that same exact analogy for heart disease prevention, because we can prevent the plaque. And testosterone reduces it, thyroid. I mean, every hormone reduces it, but nothing as strong as estradiol.
Okay. And and does is there any side effects of giving a man estradiol for like mood and other things? No. No, they just feel calm and they're okay.
They don't even know they're on
they
it.
Don't
They're
even
like, I'm
know.
going to stop taking it.
As long as your testosterone's good, it balances it. Yeah.
I said, just because you don't feel it, don't stop taking it. It's your silent protection.
I know. I always got to ask, you never know. And
I know. I've asked all these questions too, so I get it. And then when you see it in practice, it confirms what we learned.
And then I heard something about nicotine being really neuroprotective for Alzheimer's. Pure nicotine, yes. And so is that true? Is that like there's a lot of good things on that too?
There are a lot
if
of good things.
But there's like a super high addictive potential to nicotine. And I just recently quit myself. I was a baseball player, and I did.
But how did you take it though?
I took it through those pouches.
How toxic are they compared to cigarettes?
Not
Do you
even.
know?
I don't. Well, so you can get a lot more nicotine in the pouch than you can say you smoke a cigarette. Smoking a cigarette, you got to walk outside. You got to smoke one at a time, and that takes a lot of a process. Where the nicotine pouches can be used throughout the day while you're working, while you're I was a baseball player, while you're playing games, And so I do think that one. Just the abuse of it is easy, right? And so not to say that it would be fine in moderation, but I think that it's hard to moderate. And so
it is. And what is the optimal dose of nicotine? I don't know.
Yeah,
but we know what too much is. But yeah, it is. It's anti-inflammatory, nootropic for the brain, for memory.
For sure.
So yeah, I don't take it myself, but I've learned about it recently, and I have a lot of respect for it.
Yeah, and I think a lot of people have a lot of misconceptions about like how you ingest it. Sure, and a lot of people don't smoke cigarettes. Like they're not saying that,
because it's everything else in the cigarette that's inflammatory. The nicotine is the best thing in it, but all of the preservatives in those cigarettes is the problem.
Yeah, and not to mention just messing with your lungs. Like you don't want to make those any shorter than they are. Those are our main detox machines. We need those things.
Exactly.
Oh, cool. Yeah. Well, is there anything else you want to bring up before we go? We have about 5 more minutes to go.
If people are interested to buy the book on Amazon, it's very easy to read. Bring it to your doctor. All of a sudden doctors are thinking differently with the book. They're like, maybe it's not as risky as I thought. When you back things up with research, doctors are willing to listen to it.
You have to have references. There's no no personal trainer influencer is gonna switch the doctor. I've learned that actually, and so I always reference you guys when I'm talking to a different doctor. I'm like, here's my other doctor to have some reference. So you're my hormones girl. So
yep, and I love it. It's just It's a fun career. You don't feel like you're working because, it's so easy to work with people. However, there are some people who don't get as well as most, that maybe there's an emotional component, maybe there's a fear component. But I would say the majority of the patients that we treat thrive.
Yeah, I mean, and personal testament, my mother, she's lost like 53 pounds in a year. She lost over like a pound a week the past year, and she did amazing. And so she looks great. She feels great. Her energy's awesome. She's lifting more. So like, it's all good stuff.
So happy.
She is so happy. And so I thank you so much for taking care of her.
It's always my pleasure.
Yeah. And we'll actually be having one of, your clients on tomorrow. And so, we'll bring back Cynthia for another podcast.
Oh my gosh. I'll have to watch that one too.
Yeah,
Thank you for letting me know.
Awesome. Well, thanks for coming back on, and thanks for promoting the book. And thanks, guys, for listening. You can find her at Revitalize Functional Medicine. Yes. Is there any Instagram handles that we need to plug, or just Revitalize is on Instagram?
Yeah, so Revitalize Functional Medicine is our Instagram.
Okay, perfect. And then you can find them on there, and you can find them on the website. And thanks again for coming on.
Appreciate it. Thank you so much.
All right, and we'll catch you guys next week on The Price for Paradise. Aloha.
Thank you.
50 minutes.
Yay.
There it is. Perfect. Amazing.
Good.
Yes, so good. And
it was nice to tie in other things too.
Yeah, I was just going like all over the place on hormones, but I just I've been I asked all my clients about like what we should ask you. I definitely think the one with antidepressants is like just the thing. So many people get prescribed antidepressants, and then it's like they have low T. Yeah. And it's like a different problem. Yeah. And things of that nature.
And then when they go back to their doctor to take them off the T because it's risky, and then their depression comes back, and I mean it's just such a seesaw.
Yeah.
It used to be. Lately, this year, it's changing.
It's getting better.
Yeah.
Yeah, and everyone seems to be like more interested in being healthier these days.
Right, and less interested in being afraid.
Yeah. Right.